Stigma is a frequently discussed topic when exploring various health conditions. In this video, we're going to explore the health, stigma, and discrimination framework and how it can be used to create programs and policies that address stigma in society. Before we begin, let's discuss a few details about stigma. The term stigma refers to discrediting or disapproving an individual or group because of an attribute. The key concepts associated with stigma are stereotypes, prejudices, and discrimination. To better understand the framework, let's apply it to the scenario of a house that was on fire. We'll consider ourselves the fire investigators who have come to determine the cause of the fire. The health, stigma, and discrimination framework divides stigma into 4 domains and 5 socio-ecological levels. The first domain refers to the drivers and facilitators. Drivers refer to things that start the stigma, while facilitators allow the stigma to continue. This means that facilitators can be positive or negative, while drivers are inherently negative. Think of drivers as the cause of the fire. These can be several things such as cooking equipment, electrical equipment, or candles. An example of a driver of mental health stigma is the belief that people with mental illness are dangerous. This belief causes people to stigmatize individuals who are experiencing mental illness. Facilitators can be a little tricky because sometimes they help the situation and sometimes they hate it. Think of water as a facilitator for fire. For some fires, water can reduce the flame. For others, such as grease or electric fires, however, water exacerbates the problem. An example of mental health stigma is the belief that individuals who experience mental illness are incompetent. While this may be positive, as it ensures that persons experiencing mental illness are cared for, it can also be negative because it denies autonomy. Drivers and facilitators then determine the targets of stigmatization, or stigma marking, as the framework refers to it. Stigma marking can be based on a health condition or a social trait, such as race, gender, sexual orientation, socioeconomic status, or occupation. Sometimes intersections occur, and an individual's social trait can increase stigmatization. It's important to note that stigma can be tied to a condition or an intervention. While mental health, the condition, can be stigmatized, the use of medicine to treat mental health conditions such as anxiety and depression can also be stigmatized. Think of intersections as accelerants or things that indirectly contribute to the fire. Factors such as wind or accelerants such as kerosene that quicken the development of a fire can serve as intersecting factors. An example of intersecting stigma is the fact that mental health stigma is often intensified for individuals who are marginalized, such as women, LGBTQ+, and racial and ethnic minority groups. Stigma marking then leads to manifestations in the form of experiences or practices. Individuals who have experienced fire may become more cautious as they are fearful of another fire. Nearby neighbors may also begin to change their attitudes and interactions with the homeowner for many reasons. Mental health stigma can manifest in the form of internalization or persistent negative public attitudes. These manifestations then produce several outcomes for individuals and organizations or institutions. The framework also recognizes that stigma is ingrained in everything and can occur at various socio-ecological levels. After all, mental health stigma does not only occur at the individual level. It can present itself at the organizational and community levels as well. Similarly, fires don't only occur at an individual's house. There can be fires at offices, stores, and even forest fires. While we apply the framework to mental health, it can be applied to various health conditions, including HIV, leprosy, and obesity. As previously mentioned, stigma can occur at many socio-ecological levels and can be associated with a condition or intervention. Consider this framework a tool that you use every day as you work toward addressing stigma. As Kurt Lewin once said, there is nothing so practical as a good theory. Now that we've discussed the health, stigma, and discrimination framework, it's time for you to put your investigator skills to the test. As you go on this venture, remember that fire investigators not only look for the cause of the fires, but they conduct frequent inspections to prevent fires as well.